All right, so on this exercise, what we want to do is focus on working the glute. So we want to make sure that the glute is working, but we feel it on the back side here. We want to make sure that we're not getting a shift laterally or to the side. So you can use a TRX if you want to, or some sort of suspension system like this. But if you don't have that, you can also just grab onto something solid or the inside of a doorway. So I'm going to show you with the suspension system because that's what I have. So on this exercise, what we're going to do is we're just going to kind of sit back just a little bit. We really don't want to go into a deep squat or lean back. We're just holding on to this just for a little bit of balance. So I'm going to do my right leg first, and what I'm going to do is put my left leg slightly forward. My right foot's going to come, my toe is halfway between the front and the back of my foot, kind of in the middle portion of my foot, and I don't have a very wide stance here. My feet are kind of close together, you can see here. And then what I'm going to do is I'm just going to try to shift all my weight onto my right hip. Now, when I do that, I'm shifting my hip backwards. So I'm trying to take my right butt cheek and go directly back towards the wall behind me. And I don't want to lean forward too much. I actually do want to stay pretty erect when I do this. And if you're not feeling your glute contract, you want to make sure that your knee's not coming forward, that knee is back. And you really just kind of want to sit back into that hip. When you do this, if you're not feeling your glute a lot, you can try to squeeze it, do an isometric squeeze on that glute to try to get it to fire first, and then kind of sit right backwards into the hip. Remember, not out to the side. And if you feel like you keep popping out to the side, grab on a little bit more and help assist yourself with your arms, or you can put a little bit more weight through that other leg. Again, make sure you're not going out to the side, that we're going straight back. And when you're doing this, so you can see from a different angle, when I'm sitting back into that right side, I'm going back with it. There's no deviation to this side. We're just going straight back.